Liberals always make the same mistake when they analyze the impact of a program. Maybe they do it deliberately. They take a look at the initial costs or the initial inputs, and they say, oh, this is going to hurt poor people. But they don't stick around and understand that the impact of the program and the changes in the system it will trigger will benefit poor people enormously and benefit everybody in the process. And this healthcare bill is a typical example of that. First of all, what the bill does is it eliminates the requirement that you include everything in a health insurance policy and the requirement that you have health insurance in the first place. That is going to bring down the costs of these premiums and deductibles enormously, because you don't have to cover every little thing and you don't have to cover it to the full extent of the cost. You can elect to choose certain things and not other things as a consumer. If you want to buy the whole package, you can, and you'll get a subsidy for it. But if you want a more limited version of it with a lower premium and a lower out-of-pocket cost, you can do that, particularly if you want just catastrophic insurance that now you can't buy at all under the Obamacare system. That's going to lower premiums for everybody, and it's going to make it more affordable for everyone. It'll also cut the costs of the subsidies, because the premiums that are there to subsidize will not be so high. And that will result in a series of tax cuts, most notably in the capital gains tax of almost 2.5%, which will have an enormous impact on the economy. The real reason Bill Clinton was able to balance the budget in the 90s was the capital gains cut of 5%. The other half of the bill reduces the cost of Medicaid by block granting it to the states and letting the states impose all sorts of restrictions and efficiencies that they consider appropriate. Now, liberals are raising the same hue and cry about that they did about the welfare reform bill that I helped craft with President Clinton. They said that it would increase poverty, that it would increase starvation. In fact, we cut the welfare rolls in half, and we reduced child poverty significantly. What this bill does is essentially welfare reform applied to Medicaid. States are now free to apply work requirements, to require co-payments, small co-payments, $5 or $10 each, so that you can reduce utilization. In Oregon, they found that Medicaid recipients used, under the new program, used emergency rooms 40% more than they had before the program. And with no particular results in healthcare. It became sort of a new community center, the emergency room. And that imposed delays and difficulties in treating the people who really needed it. And the impact of a minor copayment, or of a work requirement, or of a drug testing requirement, so we're not constantly treating people who are making themselves constantly sicker, I think could be enormous. And I think we can substantially reduce that cost without any impact on healthcare. So in both of these areas, the premiums and the Medicaid portion, by setting in motion the changes that this bill will cause, everybody is going to benefit. This is clearly a win-win situation. And I hope that all the Republican senators vote for it. Thank you.